Okay, welcome everybody. It is Therapy Thursday. Today is February 18th, 2021. Here in North Carolina, it is yet another dreary, rainy day. Fortunately, we didn't get all that ice that we were supposed to, at least in this area around Chapel Hill, Durham, Cary area. Hope all you're keeping warm and safe. Lots of bad weather out there right now. However, on to hopefully better things. My name is Evan Adler. I am a physical therapist here at UNC Therapy Services, and I'm also the chair of the Community Engagement Committee. And what we do as a service to the community is provide educational and just general support to the general and athletic communities out there. You may have seen us out at various races doing some road race support in this time of COVID that has become not very conducive. We don't want to touch those who don't want to be touched. So we've gone more virtual, and this series of Therapy Thursday has been very well received, and we're very happy to be able to do this for everybody. So just a couple of points of order before we get going today. I briefly mentioned that this is being recorded and will live on our YouTube channel, which I will put into the chat momentarily. So if you subscribe to our YouTube channel, you'll get notified when we have new videos put up, and you'll be able to find all of our older recordings as well. Also, I encourage you to like us on Facebook, as we have some other events that pop up there and some informational stuff. And we have a whole new informational series that's going to be launching in March. So you want to be on board for that. Okay, so I'm going to put those into the chat in a few minutes. Today we have a wonderful presentation. Megan is going to be talking to us about piriformis syndrome. What a pain in the butt. If you have ever had PT, you know that we talk about butts a lot here, probably more than we should. But this is a really important topic, especially for in these days where we're doing a lot of extra sitting and we have a lot of extra tightness in that posterior quarters. So I'm going to turn it over to Megan in just a moment. But if you have questions during the presentation, I encourage you to put them in the chat. If it's something that looks pretty urgent, we'll kind of ask Megan to answer. Otherwise, we're going to try to save it to the end, and we're going to save a few minutes there at the end so we can answer those questions. All right, without further ado, I'm going to turn it over to Megan.
All right, hello everyone. Yes, we are going to be talking about butts, obviously. Piriformis syndrome, what a pain in the butt. I figured this would be a good topic since COVID has kind of disrupted our fitness life, our work life, and kind of our work-life balance. Some of you may be working from home more, stuck at a desk job, maybe have canceled your gym membership, started a new fitness routine. So I thought this was very appropriate. A little bit about me. It's still weird to see myself without a mask on. My name is Megan Shaia. I'm a physical therapist at UNC at the Ambulatory Care Center. I've almost been here for a year. My 1-year anniversary will be in April. I have a background in strength and conditioning. I've kind of seen the whole spectrum of patients going from like adolescents, kids, golfers, chronic pain, so people have had pain for a while. You can always find me on the soccer field. I enjoy playing and watching sports. I like to hike, be outside, trying to get into cooking. Love the beach, which is kind of the opposite of what we're experiencing today. I was one of those bridezillas of 2020, got married during the pandemic back in November. And I have an orange tabby cat. So that's just a little bit about me. So the objectives, trying to figure out why your butt hurts. We're gonna go over some anatomy, talk about what piriformis syndrome is, the risk factors, some of the symptoms that you'll see, try to figure out if you have it, how to fix it, or if you kind of need to see a physical therapist. All right, so what is the piriformis? So it's basically a deep pyramid-shaped muscle that's under your glute max, so that big glute muscle over on the left side. So if you kind of peel that layer back, you can see the piriformis is kind of in the middle. So if you kind of find the dimple parts in your back, and then the sides of your hip, that bony hip bone, it's kind of right in the middle. So this bone in the middle is called your sacrum or your tailbone. Right here is part of your femur, specifically the greater trochanter. And you kind of just connect those dots, and that's the piriformis. It kind of runs diagonal. So what does the piriformis do? Kind of a bunch of fancy terms to say that it moves your leg away from your body. It does lateral or external rotation, where your foot kind of fans out to the side, or abduction, kind of moving away from that midline position. And then it also plays a role in postural stability. So just kind of keeping your hips nice and level. Like when you're walking, when you're standing, running, all that sort of stuff. And what is the sciatic nerve? So it's that giant nerve that runs underneath the piriformis, if you remember from that previous picture, and it goes all the way down the back side of the leg into the outside of the foot. And kind of depending on your anatomy, your hip shape, sometimes the sciatic nerve can be just slightly different in every one. So there's some variation to it. And it can be a cause of pain in those with piriformis syndrome. So what is piriformis syndrome? So it's some sort of dysfunction or pathology of the piriformis. And that could be due to a trauma or injury or some sort of gradual buildup. So trauma could be from a fall, bending, lifting, something that caused some inflammation to the area. Or a gradual buildup, it could be from just some altered mechanics causing shortening of the muscle. It could be from long distance walking or running, or some sort of direct compression to that area causing spasm or excessive contraction of that muscle. And so that pathology can cause compression and irritation of the sciatic nerve, leading to that nagging butt or hip pain. And it could refer numbness or tingling down the backside of the leg. Because remember, the sciatic nerve runs all the way down that backside of the leg into the foot. And if you kind of look up piriformis syndrome, you may also see that it's called deep gluteal syndrome. Because if you remember from those other slides, there's a few other muscles that are near the piriformis and they're kind of deep in the hip. So it could be one of those muscles that's causing the pain as well. Can't always blame the piriformis. And what are the risk factors? Being female, unfortunately, if you're over the age of 40, if you maybe have a less active lifestyle right now or more sedentary employment, your hip shape, there's different anatomy variations with that. And then it could be from some weakness of your surrounding hip muscles in your glutes, which could lead to just more stress on that piriformis. So if you kind of balance on one leg or you're doing some single leg strengthening exercises, maybe you find that your knee kind of wobbles in and out, and that can place increased stress on either your hip or your knee. So kind of talking about that postural stability earlier, keeping your hips and knees in line. So what are the symptoms? It's usually on one side of the body. You might be developing a limp, maybe that butt pain while walking or running. The hallmark sign is more that severe pain while sitting, especially difficulty for sitting more than 30 minutes, and especially on more firm surfaces. And then kind of like what we talked about, that pain can go all the way down the backside of the thigh or the leg. And because it's kind of pressing on that nerve, you might have loss of sensation, or it kind of feels a little funny. Maybe you have weakness because the nerve is not connecting with the muscle. Some numbness, tingling, burning. Usually nervy pain is kind of like you see in that picture, that ants crawling on your leg. That numbness, tingling, burning is more of that nervy type pain. Maybe some cramping. And maybe you have some pain with squatting, or you find it a little bit more comfortable to kind of turn your leg out to the side for comfort. So how to tell if you have piriformis syndrome? So you want to rule out a bunch of possibilities of pain on the backside of your hip or your leg first. It's kind of a diagnosis of exclusion. And sometimes it can be misdiagnosed as back pain, or maybe you've gone through some back therapy and it's kind of been unsuccessful. All right, so we'll kind of go through a little quick screen. Obviously, your physical therapist will take you through a much more in-depth one, but this is pretty easy to do over the web. So basically, you want to just rule out the spine. And if you're at home and you want to stand up and just see how this feels, kind of talking about butt pain and sitting for a long time, you can do that. So basically, you just kind of stand up, and then you reach all the way down to your toes, and then you come up, and then you go all the way backwards. See if that elicits any pain. And then you kind of reach down towards one side of the knee, come up, and then reach towards the other knee. So that's what's called lateral flexion or side bending. And then you can also rotate your body. And then you can kind of see again if any of those motions are like yes, no, and then just kind of think about where is the pain when you are doing those motions. If it's at that belt line or above, could be the back. If maybe it's on that bony part of the hip, it's not really quite in the middle, could be something else. Or if it's more on that like butt bone while you're sitting down, just kind of ruling out or ruling in where exactly you feel the pain. So really with piriformis, it's kind of right in the middle. And then if you're like, yeah, I think that might be me, these are just kind of 2 tests that you can do maybe with a partner at home or probably by yourself too. There's plenty more, but these were just ones that I picked that were easy to show and supportive in the literature. But again, there's plenty out there. And then also, palpation just means pressure to that piriformis, and that might kind of cause your symptoms, or it kind of causes some spasm, so your muscle kind of shakes. So we'll go into the active piriformis test first. So you lay on your side. Your painful side is up top, and you're gonna kind of go into a clamshell. And you could put your hand there if you're doing it by yourself or your partner, and then you press outward into that hand. And because the piriformis does abduction and that external or lateral rotation, that's gonna activate that muscle. And a positive test, so kind of ruling in piriformis syndrome, would be just some positive complaints that that is the pain that I've been getting, or maybe that numbness tingling down your leg. And then this one is going to be more stretching out all of those hip rotators and the nerve. So you're sitting, that's the involved side, and he's turning the foot inwards and then bringing the whole leg inwards too. So that's gonna stretch out all of those structures. And again, if you're getting those familiar complaints of pain, you might have piriformis syndrome. So kind of how can you fix it? A few different phases. The beginning phase is more just looking at some activity modifications, improving your sciatic mobility, and then maybe some stretching. And then once you kind of calm down all of those inflammation drivers, you can move on to the intermediate and kind of some end stages, which is more for strengthening. So just some modifications you can do. Trying to reduce your sitting time. So setting a timer like 1 to 2 times per hour, and just try to get up, change your position. Doesn't really matter what you do, just try to get up and do something, even if it's for just a few seconds. And then you want to avoid sitting on those hard surfaces, so all that compression. And then maybe you want to invest in a cushion, a standing desk, although I know some fancy desk chairs are quite expensive these days. And really, you just don't want to be too lazy when you are changing your posture. You know, don't just kind of have to it, but make sure you're kind of sitting upright and nice, because a lot of times we want to go like this. So really, we just want to kind of reverse our posture and stand up. And then maybe you want to ask yourself, is my wallet in my back pocket? Because that can be something that's super compressing towards that muscle. Although these days we are not carrying around wads of cash like we used to. So maybe your wallet has changed where it's been placed. And then kind of prior to injury, were you someone that kind of sits towards one side when you're sitting, standing, driving in the car, because that can lead to some compression over time. Also walking or running on uneven surfaces or slants. And then maybe you've kind of needed to put a pillow between your knees for when you sleep, so there's not more compression on that piriformis muscle. But just kind of a disclaimer, you might be kind of shifting towards one side if you're kind of in that inflammation stage, just to kind of offload some pressure. So just kind of thinking globally of things that could have happened over time that wasn't from like a fall or something like that.
Megan, I recognize a couple of names on here who I know are runners. Could you just address a little further why walking or running on uneven surfaces or slants could trigger this?
Sure. I guess just kind of talking about, you want your hips to kind of be level as much as possible. So if you think over time, you're kind of running where one side of your leg is up higher, one side is down a little further, you're just compressing a little bit more load every time on that one side of your hip or leg. And so, maybe that right side is just really kind of taking a beating.
Yeah, and if I could just chime in for a moment, I've noticed that when people run the same course all the time, or they run on the same side of the road all the time, or because typically our roads are usually cantered a little bit for water runoff. Running that same way, the same time all the time, can produce some of that repetitive motion there that can trigger such a thing. And before we come off of this, there was a couple of people, couple of people with questions about pillows, as you mentioned there. Becky asked it. So the pillow between the knees is a good thing, and is it better to sleep on a hard or a soft mattress? So, if you had any extra information on that.
Sure. Because I don't have any like specific pillow brands, but I guess just something that kind of keeps your hips and more, or your knees in kind of a more neutral position. Because if your knees are kind of just caving in a little bit and they're almost touching, that can just stress that outside part of your hip. So depending, you don't want anything like too small or not something too large where you're kind of in that frog-legged almost position. So if you're more of a side sleeper, just finding a more comfortable position. And then I guess as far as a mattress, sometimes it can be a personal preference, but again, not something that's super compressing towards one side, or not something that's like super caved in. So kind of a happy medium with that. Did that address those questions?
Yep, I think so.
Okay.
We got a yes.
Maybe.
We got a yes.
Sounds good. All right. So if you're kind of getting that nervy type pain down the back side of your leg, numbness, tingling, this could be a good place to start because it's something simple. I put two different ways you can do it, because nerves like to kind of move in between the muscle, just like you're flossing your teeth. So it's called a nerve glide or nerve flossing. So putting the foot more towards you is going to put the nerve on a little bit more stretch than if you just kind of kept it in more of a relaxed or neutral position. So you're going to start at that kind of number one with the knee bent, and then you're just going to slowly kick it up or out until you feel a slight pull. Don't stretch beyond that. Just kind of nice and easy, and you'll kind of feel a little tug on the back side of your leg. And you can try, like 10 to 15, nice and easy. And because this is kind of a, low impact, low stress exercise, you can do it throughout the day a few times, like 2-3 times throughout the day, just to kind of calm down that nerve, try to create some space and calm down that inflammation. And there are plenty of ways to stretch the piriformis, especially if you look it up online. So it's just kind of figuring out which one works for you, especially if you're getting just a lot of tightness in that muscle, maybe a little less nervy stuff, and it feels good to stretch out that muscle. And the piriformis is a multidirectional muscle. So some people feel it with one way, some people feel it in another way. So there's not just kind of one stretch that fits everyone. So kind of this one over on the far left side, back is on the ground, on the bed, and then you're just kind of rocking the knees side to side. And you want to feel that stretch in the back part of your hip or butt. And then maybe some more familiar ones, sitting with that leg cross or that figure 4 stretch. And keeping a nice flat back, you can just lean slightly forward so you feel it again in that back side of the hip. And then kind of with these, can be a little bit more intense if you need a deeper stretch. So pulling that knee towards your chest. And then same thing with this side, more of that diagonal pull. And so the leg that you're stretching is the one that's in that crossed or figure 4 position. I guess general rule for stretching is kind of that 30-second hold 2 or so times. So for at least a total of a minute. And if you have a foam roller at home, that can kind of be an alternative way to stretch out that piriformis muscle. Just want to kind of back off if you're getting a lot of that nervy type symptoms. But usually kind of some bouts of 30 seconds or so for like 2 or 3 minutes can be plenty. And he's going into that figure 4 stretch for more of that deeper deeper stretch, and it kind of exposes that muscle so you can feel it a little bit more. I like that that comment. All right, so say you've kind of calmed everything down, things are feeling much better. You're kind of ready to move on to the strengthening phase. And just kind of a disclaimer, obviously stretching is important, but there's nothing wrong with getting strong. So for more of that long-term benefits, strengthening is a great way to go. And these are just a few exercises I picked out, kind of going from non-weight bearing exercises. So the clamshell right here. And again, that's going into that muscle activation of the piriformis. Obviously, you can use a band or a belt at home if you think that that's too easy for you. You need a little bit something else, but just kind of placing that band or belt above your knees. And again, if you don't have a lot of equipment at home, you can always go for longer holds. Like, okay, I'm gonna bring that knee up and hold it for 30 seconds, relax, and then I'm gonna try it again. So plenty of ways to make things more challenging, but still activating the right muscle. So that's kind of clamshells. And then bridges up here, you can do it with or without a band. With a band, you're just activating all of those outside hip muscles, making your glutes and that piriformis activate and engage. And then you're also working on that hip stability. So is my leg rocking side to side, kind of all over the place? She's keeping her hips nice and stable. And then side lying hip abduction. Again, you don't want to roll those hips back. You want to keep them nice and level. And then you're just bringing it up. And then just slightly back. We'll get those glutes firing a little bit more and back down. And then once you've kind of mastered those, you can kind of go on more of the advanced stages. And these are just a few that I picked out, just so you can kind of see the sequence of functional task into more of a squat. So kind of going from those bridge positions to, okay, a squat. And then again, he's just kind of activating all of those outside of the hip and leg muscles right there. And then if you love planks, side planks are a great way to activate those glutes too. And there's a million kind of single leg strengthening exercises too, but I'll provide more resources on that. Those are just two that I picked out. And then kind of, do I need to see a physical therapist about this? I think it really depends on how long this has been going on and how it's impacting your daily life. How debilitating is this? Or say you kind of did this screen today and you're like, I don't really think that this is for me. I'm thinking it's something else. Or maybe you tried these exercises and mobility drills you found today for a little bit, and then just kind of see where that takes you. Then obviously my PT plug, of course, I'm going to tell you to come to PT because we are the movement experts. So if kind of like what we talked about, you've been running on the same trail, you know, anything that we talked about, we can look at how you're moving and walking and running and just see any sort of compensation patterns you may have. And if you hate the foam roller, you don't want to do it, but you like kind of the hands-on treatment with physical therapy, we can kind of do some hands-on techniques and treatments to relieve that spasm and tightness. And we can also, if you started a new routine, like you're doing a lot of like lunges or single leg RDLs, single leg squats, we can kind of look at those mechanics and see like, okay, are your hips level? Is your knee kind of caving in? Are you doing things safely and well so that you can get stronger? So just my PT plug. Obviously, we do a lot more. All right, and so just kind of a little summary. As you can see, piriformis syndrome can be a real pain in the butt. Pun definitely intended, based off of the anatomy and that presentation of pain. And because I was a East Carolina Pirate, I'm gonna kind of go with a terrible joke, but you can kind of think of the piriformis as holding hostage or trapping the sciatic nerve, and the sciatic nerve is retaliating. So you're getting that burning, cramping, and tingling down the backside of the leg. And weirdly, while I was creating this PowerPoint yesterday, I found this resource. So if you want some more challenging exercises or you just kind of want to learn more about piriformis syndrome, I found this video super helpful to watch. And they put out a lot of good content. So you can watch that video. It's about like 14 minutes total, but it's good. And that is it. So if anyone has any additional questions, I would be happy to answer.
Megan, that was great. Yeah, thank you so much. Yeah, there were a few questions that were in here, and we'll get to those in a moment. But I just want to remind everybody that this will be posted on the YouTube page, because there was a question there about obtaining the slideshow. We don't have a great way to host all of the slides, but this will be posted on our YouTube page, and you can access it whenever you want and get all the information you need out of there. So I think I have just there were a couple of questions earlier on that I think they're a little easier to address. And
Sure.
so one of the question was about a mattress, a soft or a hard mattress. Um, if you would recommend one over the other as far as this was concerned.
Um, yes. Sometimes it can depend on what type of a person you are and what you like. Anything that's overly firm can be a little bit kind of compressing towards your joints. But obviously, you don't want anything too deep where you're kind of sinking out to the side and you're not kind of maintaining that neutral alignment. But obviously, pillows and things can help. Because mattresses are, of course, a pricey investment. So something I think that's kind of in between, especially if you're a side sleeper. I don't know if you have any recommendations, Evan.
I think it's personal preference. I think, being sinking down into a soft mattress, you may have other issues that develop from it being too soft. But I think a better fix is that pillow between the knees to help keep the legs kind of parallel as best as they can be without one dropping over the other or the knees coming together too far. And I think that kind of speaks to why women have more issues with sciatica versus men, just because of the natural anatomy of the wideness of the hips. So the legs just will start to come in together this way a little bit more, which is going to create more of a stretch on that outside portion, which is where the piriformis is located. Um, so as far as the mattress is concerned, it's a personal preference type thing. And then there was another question about let's see, someone asked about using a lazy tennis swing movement. Can that trigger this?
Um, Potentially, I think I would have to look at how you're swinging and your mechanics. So I think it depends.
Yeah, as PTs, it depends is kind of our motto. It's everything is individualized. So I'd say that sure, it could trigger it if it's a lazy tennis swing where your hip is kind of just jutting out to the side and you're dropping your arm more. Just having your whole body make more of a curve than being kind of supported upright, then absolutely it could trigger it. Is it the main and only contributing factor? Probably not. Um, so that's that's our take. That's my take on that. Um, yeah. There was a question about foam rolling. Are you sitting on it, or are you just using the foam for a massage while you stretch? When you're doing that roller for your piriformis, you're because your leg is bent and kind of twisted up a little bit. You're exposing the muscle and putting it on stretch already. So you are kind of bringing it more to the surface. So yeah, you pretty much are sitting right on it, but it should be done to tolerance. It shouldn't be a pain provoking experience. The best way to tell if it's too much pressure is immediately when you're done. When you come off of that roller, that pain should go away. There should be no lingering pain after you're done rolling. Um, yeah, so it should be my favorite. My favorite term recently is tolerable discomfort, which basically is PT in general, right? Tolerable discomfort. It's like visiting your families for Thanksgiving. Tolerable discomfort. Um, so you should be able to get a little bit of that discomfort, a little bit of that stretch, but then it goes away. The pain goes away when you're done. Let's see. I think we have time for one more question. So there was one here about thoughts on a steroid injection. Megan, do you have any thoughts on that?
It wouldn't be my first go-to option. So I guess if you've exhausted other options, you've tried physical therapy first, potentially, but I would try other options before I went to injections. But I know some of us PTs are also dry needling certified as well, so that could be a good way just because that muscle is super deep in there to just kind of relieve that local spasm, that tone, and just calm down the muscle.
Yeah, I would definitely agree. It wouldn't be my first go-to just because of the nerve aspect of it. Um, But yeah, like Megan said, there are other things that we do: targeted stretching, targeted soft tissue release. A lot of us are certified in dry needling, and piriformis is an often dry needled muscle. It's actually fairly easy to get to, even though it's a deep muscle. It's a straight shot right in. So it's there are other ways, but yes, it is. Yeah, it's an option. It is an option. Okay. All right. Well, I put those links in the chat again for our YouTube channel and our Facebook page. I also just put in there, if you have more questions for us today, you can send Megan an email directly. She doesn't know that I said that, but now she does. I also put my own email address in there as well. So if you want to email me, Evan, at directly, I'm happy to answer more questions for you. Someone just asked about Zoom versus WebEx. Because we're doing this through UNC Health, we are going to keep it on WebEx until I get permission and an account to do so otherwise. So unfortunately, this is what we're doing for now. But if you miss it, again, you can always find it on the YouTube channel no later than the day after. So thank you, everybody. Thank you so much for all of your help and all of your attention today. And I hope you had a good educational session. Thank you, Megan. Thank you, everybody, and have a wonderful rest of your week.
Thank you so much.
All right. Bye, all.